The world of illicit drugs is fraught with danger, but some substances stand out as particularly hazardous due to their potency, addictive nature, and devastating consequences on users' health and well-being. In this video, we delve into the top 5 most dangerous drugs: fentanyl, carfentanil, methamphetamine, cocaine, and heroin. These drugs have been associated with significant risks and harm, leading to increased overdose rates, long-term health issues, and a strain on public health resources. By understanding the dangers posed by these substances and raising awareness of their effects, we can help to prevent drug abuse, addiction, and the tragic outcomes that often follow. Join us as we explore the shocking truth about these deadly drugs and learn how to stay informed and safe in the face of this global crisis. 1. Fentanyl. Fentanyl is a synthetic opioid that was first developed in 1959 by Belgian chemist Paul Janssen. It is primarily used in medical settings for pain management, particularly for severe or chronic pain, as well as for anesthesia during surgery. Fentanyl is highly potent, being approximately 50 to 100 times more potent than morphine and 25 to 50 times more potent than heroin. Due to its potency, it is typically prescribed in microgram doses. While fentanyl has legitimate medical uses, it has also become a dangerous and deadly drug of abuse. Illicitly manufactured fentanyl and its analogs have infiltrated the drug market and are often mixed with other drugs, such as heroin, cocaine, and counterfeit prescription pills. This combination significantly increases the risk of overdose, as users may be unaware that they are consuming fentanyl or the actual dosage they are taking. Fentanyl's high potency and rapid onset of action make it extremely dangerous. It can cause respiratory depression, which can lead to a lack of oxygen in the body and ultimately result in coma, brain damage, or death. Naloxone, an opioid antagonist, can reverse the effects of a fentanyl overdose if administered in a timely manner. However, due to fentanyl's potency, multiple doses of naloxone may be required to counteract the overdose. The abuse of fentanyl and its analogs has significantly contributed to the opioid crisis and an increase in overdose deaths in recent years. According to the Centers for Disease Control and Prevention, CDC, fentanyl was involved in approximately 59% of opioid-related deaths in the United States in 2017. Efforts to address the dangers of fentanyl include increased regulation of its distribution, development of more potent naloxone formulations, and public awareness campaigns about the risks of fentanyl and how to recognize and respond to an overdose. Additionally, harm reduction strategies, such as supervised consumption sites and expanded access to addiction treatment, have been implemented in some areas to help reduce the risks associated with fentanyl use. Carfentanil is a synthetic opioid that is chemically similar to fentanyl, but it is considerably more potent. It is estimated to be 100 times stronger than fentanyl and 10,000 times more potent than morphine, making it one of the most powerful opioids known. Carfentanil was first synthesized in 1974 by a team of chemists at Janssen Pharmaceutica, the same company that developed fentanyl. 2. Carfentanil. Carfentanil is not intended for human consumption. Its primary use is as a sedative and analgesic for large animals, such as elephants and other wildlife. Due to its extreme potency, even a few micrograms of carfentanil can cause severe respiratory depression and potentially be lethal in humans. The drug is so potent that veterinarians and other professionals who handle carfentanil must take special precautions, such as wearing protective gloves and masks, to avoid accidental exposure. Despite its intended use, carfentanil has found its way into the illicit drug market. It has been mixed with or substituted for other drugs, such as heroin, fentanyl, or counterfeit prescription pills, without the user's knowledge. This has led to a significant increase in the risk of accidental overdose and death, as even a small amount of carfentanil can be lethal. The extreme potency of carfentanil makes it difficult to treat an overdose effectively. While naloxone, an opioid antagonist, can be used to reverse the effects of an opioid overdose, the standard doses may not be sufficient to counteract carfentanil. Multiple doses of naloxone or a more potent formulation may be needed to successfully reverse a carfentanil overdose. To combat the dangers of carfentanil and other potent synthetic opioids, law enforcement agencies and public health organizations have implemented a variety of strategies. These include increased regulation and control of precursor chemicals, improved detection and interdiction of illicit shipments, and raising public awareness about the risks associated with synthetic opioids. Harm reduction initiatives, such as the distribution of naloxone and the establishment of supervised consumption sites, have also been introduced in some areas to help reduce the risks associated with carfentanil use. 3. Methamphetamine. Methamphetamine, commonly known as meth, is a powerful and highly addictive central nervous system stimulant that affects the brain's dopamine and norepinephrine levels. It was first synthesized in 1919 by Japanese chemist Akira Ogata and has since been used for various purposes, including as a treatment for attention deficit hyperactivity disorder, ADHD, and obesity under the brand name Disoxin, albeit in lower doses than those typically found in its illicit form. Methamphetamine can be consumed in several ways, including smoking, snorting, injecting, or ingesting orally. The drug's effects are characterized by increased energy, alertness, and euphoria, as well as decreased appetite and need for sleep. However, these effects come with significant short-term and long-term risks. Short-term effects of methamphetamine use can include increased heart rate, blood pressure, and body temperature, as well as irregular heartbeat, anxiety, aggression, and paranoia. These effects can lead to dangerous situations, as users may engage in risky behaviors or experience accidents due to impaired judgment. Long-term methamphetamine use can result in severe physical and mental health consequences. Some of the most common physical health issues associated with chronic methamphetamine use include 1. Cardiovascular problems. Long-term meth use can damage blood vessels and the heart, leading to an increased risk of heart attacks, strokes, and other cardiovascular issues. 2. Respiratory issues. Smoking methamphetamine can cause respiratory problems, such as bronchitis and lung damage. 3. Dental problems. Meth mouth refers to the severe tooth decay, gum disease, and tooth loss that can result from methamphetamine use, which is attributed to a combination of poor oral hygiene, dry mouth, and teeth grinding. 4. Skin infections. Chronic meth users may experience skin sores and infections due to constant scratching and picking at the skin, as well as poor hygiene and immune system suppression. Methamphetamine also has detrimental effects on mental health. Chronic users may experience cognitive decline, memory loss, and difficulty concentrating. The drug can also exacerbate or cause mental health disorders, such as depression, anxiety, and psychosis. Furthermore, methamphetamine use can lead to addiction, which can have devastating consequences on an individual's personal, professional, and social life. To address the dangers associated with methamphetamine use, various prevention and intervention strategies have been implemented. These include public awareness campaigns, targeted prevention programs for at-risk populations, increased regulation and monitoring of precursor chemicals, and the provision of evidence-based treatment options for those struggling with methamphetamine addiction. Harm reduction measures, such as needle exchange programs and supervised consumption sites, have also been introduced in some areas to mitigate the risks associated with meth use. 4. Cocaine. Cocaine is a powerful central nervous system stimulant derived from the leaves of the coca plant, which is native to South America. It has been used for centuries by indigenous people for its stimulant and anesthetic properties. In the late 19th and early 20th centuries, cocaine gained popularity as a medical anesthetic and was even included in products like the original Coca-Cola formula. However, as its addictive potential and harmful effects became more apparent, the use of cocaine became increasingly regulated and restricted. Cocaine is typically consumed by snorting, smoking, or injecting the drug. It works by increasing levels of dopamine in the brain, resulting in feelings of euphoria, increased energy, and heightened alertness. However, these effects are short-lived and often followed by a crash, which can lead to intense cravings for more of the drug. This cycle can quickly lead to addiction and a range of physical and mental health problems. Short-term effects of cocaine use include increased heart rate, blood pressure, and body temperature, as well as dilated pupils, constricted blood vessels, and increased risk of heart attack or stroke. Users may also experience anxiety, paranoia, irritability, and restlessness. These short-term effects can pose immediate risks to the user, as they may engage in risky behaviors or experience accidents due to impaired judgment. Long-term cocaine use can result in a host of physical and mental health issues, including 1. Cardiovascular problems. Chronic cocaine use can damage the heart and blood vessels, leading to an increased risk of heart attacks, heart failure, and strokes. 2. Respiratory issues. Smoking crack cocaine can cause respiratory problems, such as bronchitis, asthma, and lung damage. 3. Gastrointestinal problems. Cocaine use can lead to gastrointestinal issues, including stomach pain, nausea, and bowel gangrene due to reduced blood flow. 4. Nasal and sinus issues. Snorting cocaine can cause damage to the nasal septum, sinus infections, and nosebleeds. 5. Neurological problems. Chronic cocaine use can result in seizures, headaches, and an increased risk of hemorrhagic strokes. 6. Cognitive and mental health issues. Long-term cocaine use can lead to cognitive decline, memory loss, and difficulty concentrating. 6. It can also exacerbate or cause mental health disorders, such as anxiety, depression, and psychosis. Efforts to address the dangers of cocaine use include public awareness campaigns, targeted prevention programs for at-risk populations, and increased regulation and monitoring of the drug's production and distribution. In addition, evidence-based treatment options for those struggling with cocaine addiction, such as cognitive behavioral therapy and contingency management, are available to help individuals overcome their dependence on the drug. Harm reduction measures, such as needle exchange programs and supervised consumption sites, have also been introduced in some areas to mitigate the risks associated with cocaine use. 5. Heroin. Heroin is an opioid drug derived from morphine, a natural substance extracted from the seed pod of the opium poppy plant. First synthesized in the late 19th century by German chemist Heinrich Dresser, heroin was initially marketed as a non-addictive alternative to morphine and a cough suppressant. However, it soon became apparent that heroin had a high potential for addiction and abuse, leading to its classification as an illegal drug in many countries. Heroin can be consumed by various methods, including smoking, snorting, or injecting the drug. When ingested, heroin enters the brain and is converted back into morphine, binding to opioid receptors responsible for the perception of pain and reward. This leads to a surge of dopamine, creating a sense of euphoria and intense pleasure. However, these short-lived effects can quickly give way to addiction and a host of physical and mental health issues. Short-term effects of heroin use include drowsiness, heaviness in the limbs, and a warm flushing of the skin. Users may also experience dry mouth, nausea, vomiting, and severe itching. Heroin use can cause respiratory depression, leading to slow and shallow breathing, which can be life-threatening. Long-term heroin use can result in a range of serious health problems, including 1. Physical dependence and addiction. Chronic heroin use can lead to physical dependence, where the body requires the drug to function normally. 1. This can result in withdrawal symptoms when the drug is not available, driving individuals to continue using heroin to alleviate these symptoms. 1. This cycle can quickly lead to addiction. 2. Infectious diseases. Injecting heroin with shared or contaminated needles increases the risk of contracting infectious diseases, such as HIV and hepatitis B and C. 3. Cardiovascular issues. Chronic heroin use can lead to collapsed veins, bacterial infections of the blood vessels and heart valves, and other cardiovascular problems. 4. Respiratory issues. Heroin can cause chronic pneumonia and other respiratory infections due to its immunosuppressive effects and the drug's impact on respiratory function. 5. Gastrointestinal problems. Constipation, bowel obstruction, and other gastrointestinal issues can result from long-term heroin use. 6. Kidney and liver disease. Heroin use can contribute to kidney and liver damage, particularly when the drug is used in combination with other substances. Efforts to address the dangers of heroin use include public awareness campaigns, targeted prevention programs for at-risk populations, and increased regulation and monitoring of the drug's production and distribution. Additionally, evidence-based treatment options for those struggling with heroin addiction, such as medication-assisted treatment, MAT, with methadone or buprenorphine, as well as behavioral therapies, are available to help individuals overcome their dependence on the drug. Harm reduction measures, such as needle exchange programs and supervised consumption sites, have also been introduced in some areas to mitigate the risks associated with heroin use.